Hi ladies and gentlemen, my name is Corie Williams and I am on the professional track for graduate school in the College of Media and Communications at Texas Tech University. I'm currently enrolled in the PR 6315 class, and today I'm going to tell you about a relatively recent communication campaign. This campaign details efforts of organizations to educate and equip individuals in the healthcare industry to correctly administer the human papillomavirus vaccination. First, let me give you a little background information that some of you may already be familiar with. In the fall of 2009, all incoming freshman females to Texas Tech University were required to provide proof of vaccination before enrollment was released, and each individual was allowed to move into their dorm. This requirement was not abnormal for universities even today. It absolutely makes sense for a university to require health preventative vaccinations for all incoming students in order to protect students that are already here. There was one unique requirement, however. All females were required to receive the human papillomavirus vaccination, better known as the HPV vaccination. The most common of these vaccinations is the drug known as Gardasil. Gardasil is the vaccination distributed by Merck & Company and is recommended for women 9 years to 26 years old. Gardasil is used in the prevention of cervical cancer caused by sexually transmitted diseases such as HPV. She was diagnosed with a negative reaction to Gardasil and began a course to rid her body of the vaccination. It was a long process, but today Bailey is a happy and healthy young woman educating other young women on the dangers of a blanket requirement. But what other options does a female have? Every woman is required to show proof of vaccination, but what if that individual is prone to have a negative reaction to Gardasil? Blanket requirements from universities can be dangerous, but efforts by healthcare professionals to screen for a greater likelihood to negative reactions to the HPV vaccination could help guard those women against non-fatal reactions. In efforts to reduce the risk for individuals, numerous communication campaigns have focused on proper education and dissemination of the vaccine material. One such article, written in 2006, details the proper strategy for effectively promoting the acceptance of the HPV vaccination. The author's primary argument is that pharmaceutical companies, public health advocates, medical trainers, and health educators need to understand their diverse audiences and respond appropriately to the needs of each. For each organization entrusted with the dissemination of this information, there are numerous hindrances. A 2005 PATH survey found that policymakers generally view cervical cancer as a health issue, but statistics are widely unavailable to aid in the policy agenda formation. Healthcare providers are on the front line of education and information for patients regarding the vaccine. Therefore, these individuals will need training, education, and communication tools to facilitate effective discussions with their patients, such as simple talking points and visual aids. Like any communication campaign, the message must be specially targeted to each audience. It must appeal to their beliefs and value systems, along with an understanding of previous knowledge regarding the issue at hand. Pharmaceutical manufacturing companies are also primarily responsible for public education and advertising campaigns regarding their vaccinations. Their efforts will be the most successful in developing nations where the campaign has a broad reach and has more influence. Message content would be most successful if focused on the following objectives. Clients understand their risk and the consequences of infection. Healthcare providers encourage use of intervention and have good counseling skills. Positive images of product are featured in media and in community consciousness. Vaccine is readily available as a part of a reliable, high-quality health service. Client reminder systems are in place. A supportive policy environment exists. For instance, vaccination is required for school entry and subsidized services are available for the poor. And last but not least, clients' out-of-pocket costs are minimal. All in all, for an HPV vaccination communication campaign to be successful, the message must be in coordination with policymakers' agenda, pharmaceutical manufacturing companies' message, and healthcare providers' information. Only then will a communication strategy be truly effective. Only then will a communication strategy be truly effective. One such communication strategy focused on parent and adolescent acceptance of the HPV vaccination. Researchers from the University of Rochester in New York gathered patients from 9 local primary care clinics. Adolescents from these clinics were randomly selected and were contacted to participate in a phone survey. 57% of the respondents and parents surveyed were female. 66% of the female patients surveyed reported that a nurse or doctor had discussed the vaccination with them, and 59% of the females surveyed had reported at least one dose of the 3-part vaccination. On the other hand, 17% of the parents had refused the vaccination for their child. Parents who viewed the vaccination as unsafe were far more likely to refuse the vaccination for their child. The research suggests that the strength of the provider's recommendation may have influenced refusal rates. Generally, Hispanics were more likely to refuse vaccination, but this was due in part to the cultural background of the individuals involved. In order for a communication campaign to be more successful in the future in primarily Hispanic communities, further research must be conducted to identify barriers of communication. From the results, it is clear that sufficient research was not conducted prior to the release of the vaccination. And although theory was initially mentioned in the Education, Training, and Communication for HPV Vaccines article, no specific theory was identified as the most successful when communicating health-related information. Therefore, new strategies are needed to deliver effective, culturally specific messages to help parents who are unsure about vaccinating their adolescent. Perhaps theory-based communication strategies coupled with audience research would better communicate the message to subcultures. As with any communication strategy, there will always be unintended effects. Such unintended effects include the college requirement for incoming freshmen that many universities required, not just Texas Tech University. Girls who are susceptible to the side effects of the vaccine are pressured into taking the vaccine with little regard to their individual health. In this way, detailed communication campaigns would be most beneficial in educating healthcare providers on the dangers of certain subgroups who are susceptible to those negative effects. Now that the original vaccination communication campaign is almost a decade old, in-depth research would help identify holes and future possibilities in the campaign. Such research should be devoted to subcultures like adolescents of Hispanic descent or individuals who have had adverse reactions to the vaccine. From there, strategies can better educate healthcare providers on appropriate messages. Thank you so much, and I hope you enjoyed this video presentation. Good luck.